Good morning or good afternoon, wherever you may be, and thank you for joining our live broadcast this morning, which is really to help you live better and control living with IPF and pulmonary fibrosis. We have three great guests today. We have Matt Cullen, who is a pulmonary fibrosis patient and an advocate with a lung fibrosis association. Ron Flewett, who likewise has pulmonary fibrosis and works with a number of different patient advocacy groups. And we have Jennifer Wescoe, whose father passed away from pulmonary fibrosis and was inspired to start the Wescoe Pulmonary Fibrosis Foundation. Each of them have a great story to tell, and also we hope can answer some of your questions today. So let's, without further ado, start and introduce Matt. So Matt is from Ireland, and I've had the pleasure of knowing him and working with him over the last few years. Matt, tell us a little bit about yourself.
Thank you, Eamon. Welcome, everybody. Just to let you know that I was diagnosed with idiopathic pulmonary fibrosis in 2010. Now, what's remarkable about that is that I was actually seen by a cardiologist, and he said there's good news and there's bad news. And the good news is that he said your heart is okay. But he said I noticed there was something on the lungs, and he referred me to a respiratory consultant. And through a HR CT scan, it was revealed that I had IPF. Now, that was in 2010, and I was getting breathlessness, mucus, and quite a lot of fatigue. But in all honesty, I just accepted what was said when I was told what it was, and I never really ventured into it at all until 2013, when I really went through a very bad patch. And at that time, it would be interesting to point out that other issues developed. Namely, I was diagnosed with COPD, rheumatoid arthritis, and then actually quite recently, bronchiectasis. But why I'm telling you that, and for everybody concerned, is that I just felt okay, and it never occurred to me to ask much about it. But when I went through that bad patch, I was really scared. I didn't know anybody with that complaint, and I was very, very fortunate because I got in contact with the Irish Lung Fibrosis Association, and I felt that from their help, it was just amazing because from being very isolated to a situation where I was in contact with people that had a complaint. Now, unlike what you might look up, you'd be maybe looking up the internet if anybody is out there and just recently been diagnosed, rather than have that situation where it just kind of would floor you to some extent, it was a very positive intervention. So, if you like, joining a support group, and then they provided me with an information pack and all their information quite like that I felt it was a turning point for me. Now, look, although it doesn't change the situation, but what has happened really is I've managed better with my health as a consequence of that. And psychologically, it's an awful lot better to be with people that are positive. And then not just that, but it's the information you get is very accurate. Like from ILFA, the Irish Lung Fibrosis Association, the short name it would be ILFA. And through their help, I felt that I was getting factual information. I felt that, the way things were evolving, I felt an awful lot better. So I went from doing little or no exercise to actually reversing the process. So here we are now, continued on right up until now. Now, admittedly, the breathlessness and, other situations have got worse. But nevertheless, for anyone out there that's just, doesn't know much about the disease, all I would say to you is that this has been a very positive experience, despite how bad the prognosis is. And I'm saying to everybody that, look, that's my journey so far, and it's been a rewarding journey in many respects. So I see it, no matter how negative, it might be getting the results, but there's a very positive experience from it.
Sounds very
and that would be my experience.
I'd like to
in the last, just a few months now, it's been particularly bad with the bronchiectasis side of things, but I'm able to manage it a lot better as a result of that support.
Sounds good.
So that's my brief story.
This is Ron now. Ron, tell us a little bit about yourself as well.
Hello, good afternoon, everyone. Thanks for inviting us to this panel. My name is Ron Flewett. I was diagnosed at the age of 54, like Matt, with idiopathic pulmonary fibrosis. That day actually changed my life. I was an ex-triathlete, done many triathlons. I went to the doctors after feeling extremely breathless, not being able to run, not being able to swim, not being able to cycle. Many tests, including a CT scan, lung biopsy, bronchoscopy, and a lung wash. So I was eventually diagnosed in April 2014 with IPF. Since then, I decided there are two roads to take, either negative or positive. I took a positive road, and I've carried on exercising with my limits. I've carried on cycling where I can. I've carried on going out as much as I can, and I still work part-time. I've recently gone onto oxygen. I'll take it back a step there, actually. I've recently gone to oxygen, but I do still go out on my bike cycling. I do go out walking as much as I can. When I was diagnosed from Peterborough, I was actually said by the consultant he wouldn't treat me because he may make my condition worse, so he referred me to Papworth Hospital. And in my opinion, going to Papworth has been my saviour, because I was put on to pirfenidone, antifibrotics drugs, and from there I've only lost about 10-12% in the 4 years that I've been diagnosed. Since I've become a trustee of the Pulmonary Fibrosis Trust, I chair a support group. I'm a clinical ambassador at Papworth Hospital, and I attend EU-IPFF meetings on a regular basis. So what I'm trying to say is, although I was diagnosed with this terrible illness 3 to 5 years ago, I've made the most of my life and decided to make a difference and help make this disease become a recognised disease. That's about it. Thank you.
Ron has some really good stories that have been featured by a lot of newspapers, which if we have time, we might get to later on. But now I'd like to introduce Jen Wescoe to tell her story.
Hi, everyone. This is Jennifer Wescoe, and I'm the Executive Director of Wescoe Foundation for Pulmonary Fibrosis. Just a little backstory as to why we're in this wonderful position in order to be a support and educational basis for patients living with IPF. My dad, Ron Wescoe, passed away from pulmonary fibrosis on October 29th, 2004. And my dad, I'm a typical daughter of a loving dad, dedicated, had all the time in the world for us. And I have two older brothers too. And we felt very lost, very alone, as we all talk about in managing and moving forward and learning more about pulmonary fibrosis. And thankfully, my brother, ironically too, he is a respiratory therapist. So he educated us about pulmonary fibrosis and what we were about to experience as a family, not only for my dad, but also for the entire family. And so from that point on, I knew I didn't like feeling alone. I'm sure clearly my dad did not, and our family as a whole did not. And so it was very important for me to move forward, and our foundation to move forward to provide support groups as much as we possibly can. And the tremendous need for that support and networking with patients and their families. And educational programs. So through my dad, we've used this as a very important tool for outreach and support for families living with pulmonary fibrosis every day.
Sounds excellent, Jen. And I know you run numerous events throughout the year, raising funds and helping patients. So, and I believe you've an event next month.
Oh, we do. Thank you for pointing that out. We actually have, we talk a lot about support groups, education programs, but IPF, pulmonary fibrosis community awareness events are tremendously important to let the public know about it, sooner the better, earlier diagnosis, and to let patients and their family know that an entire community is behind them in moving forward to be able to, look out in the entire community and say, oh, okay, I'm really not alone. We have a whole army behind us. So we do have an event on Saturday, May 26th. And it's called Coopersburg 5K for pulmonary fibrosis. And you can learn more information on Coopersburg5K.org. And this is our 12th year. So more we can do, the better. We have several events throughout the year. As I said before, the informational aspect of it is so important because you could go through the event, post signs all over the place about pulmonary fibrosis, its prevalence, incidence, symptoms, and through that, not only verbally, but through those other aspects, you could reach out every way possible to let folks know about the disease.
Sounds excellent. So to our audience listening in, please, any questions you have, put them into the comments section on the video. We've had a number of questions emailed in from people in advance of the broadcast, so I'd like to get to some of those now. So Jen, maybe start with you. For someone who is just recently being diagnosed, what do you advise people, when they're just getting to grips with their diagnosis?
It's as I think a lot of people would agree with, getting that information is profoundly, clearly, it's a change of life route. And a lot of people, and we often hear about this, is what day, and we reach out to the internet, and it gets to be very scary, overwhelming, something that is hard to manage when you get a diagnosis with pulmonary fibrosis. So what I would recommend is get with reputable organizations: Pulmonary Fibrosis Foundation, American Thoracic Society, Chest Foundation. Another program, Pilot for IPF, is a great support. So those type of, an American Lung Association, of course, are great resources for patients to look for instead of, what is this story saying? What is that story saying? Where that this is found as scientific information, but also getting connected with the support and education. And so we talk a lot about moving forward as a wraparound approach. We talk about the medical treatment, we talk about pulmonary rehab, oxygen management, palliative care, and support and education. So literally, it's a complete hug, if that lack of better words, of moving forward so that folks don't feel alone. And we have a wonderful IPF and pulmonary fibrosis community for outreach and telling your story and talking with your family, because you go through this cycle of acceptance, and everybody's very, very different in accepting pulmonary fibrosis or any type of illness, and moving forward and talking with your family. How do I do that? What does that look like? And so, the umbrella of moving forward is getting in contact with the credible foundations and scientific groups to give you the proper information and find that support network. That's so very, very, and get educated. It's very, very important. But everybody has the process, and they're ready at X amount of time for what they're feeling and they're going through as a patient and as a family. So one step at a time.
Yeah, I mean, the access to good, validated information is so important. Matt, could you tell us a little bit about your pulmonary rehab? Because I know that's something that Jen just touched on there a moment ago. Hi guys, sorry my machine crashed.
Oh, of all times, Eamon.
Yes, and Matt, your microphone was muted, so could you just repeat that?
Matt, you had a
I will indeed. Okay. Right. I'll start afresh. Right. I was saying I go to pulmonary rehab. It's been a very positive experience. Can you hear me all right now? Great. So I've been going to pulmonary rehab since 2014. And one thing I'd say about it is that it's not in a hospital setting. It's a university, and all sorts of age groups attend there. Not in the session where I am, but close by. So you don't feel as though you're in a hospital setting. It's just very relaxing. But it's not just that. But it's just that it's 2 days a week. They're 1 hour sessions. Now it's primarily exercise, but you do on occasions get a little bit of an input, maybe about diet and nutrition. But basically, the most important thing about it is that you're with other people with respiratory complaints. So, you can learn from that. As I told you, that's the reason why I said at the outset about having COPD. So some of the patients there would have COPD, and some would have asthma, IPF. So you're learning from their experience. But it's not just that, it's a social side of it. At the end of it all, you'd have a cup of tea, maybe 1 or 2 biscuits, not healthy eating and all that, you have to be careful. But as I said to you, it's very relaxing, because another factor is that I love music. I love the music of the 60s, that would be my era. So that's what's played in the background. And for most of the people there, that's the age group they may be catering for. So that makes it all the more enjoyable. And that's why I think exercise should be fun. It should be enjoyable. It's not, and then, when people hear of exercise, they think, oh, good God, that's just a chore.
All the better if you can fit it into your routine as well.
Correct. So that's been my experience since 2014, and I'm going to keep at it. It certainly is very helpful,
There's another sports-related question that's come in for Ron. So it's from John Conway. Ron, following diagnosis and as a keen triathlete, how did you approach and balance the need to exercise while at the same time not exposing yourself to other conditions such as pulmonary hypertension?
Well, when I was first diagnosed, I carried on as normal, and I thought being out of breath and taking my heart rate up and cycling up hills was okay. Like Matt, I went to pulmonary rehab or rehabilitation, and quickly learnt that if I take my heart rate up too much, my oxygen levels can dip quite dangerously. So pulmonary rehab taught me an awful lot on how to look after myself, and I'd like to say exercise within my new limits. I.e., when I go out on my bike, I've linked my oxygen levels to my heart rate. So I know that sort of keeps stopping on my bike and taking my my stats. I know that I shouldn't take my heart rate above 120. But that 120 is to my heart rate. I'm not saying everyone else should take their heart rate to 120. But what I've done, so as soon as I go above 120, I will stop, I will regenerate my lungs, and then I will carry on. What I actually do now is, when I was going cycling at the end part last year, I noticed my oxygen levels would go down to 84, 85. when I was cycling on a flat. So I had a discussion with my ILD nurse, and he's given me some little oxygen cylinders, which allows me 2 hours out of my bike. And I cycle now with 3 litres, 3 litres, and I've noticed that my oxygen levels are remaining above 90, which is very important to keep those above 90. So yes, I still carry on cycling, I still go on walking. When I walk, I take my oxygen with me. So I would say to anyone, if you notice your sats go low, ask for oxygen and carry on maintaining within safe limits.
And a very interesting thing about Ron, do you want to mention a little bit about your love of holidays and being featured by some major news publications?
Well, my love of holidays and my love of cycling, what I actually forgot to say was, since my oxygen levels have started going, I've actually invested in an electric bike. So it makes my cycling a lot easier. Me and my wife, when we got diagnosed, and I have been progressing very slowly, we decided that we should make up a bucket list. So our bucket list is 50 countries in 2 years. And the only way we can achieve this is by cruising. So my wife is constantly looking at cruises every morning, constantly saying, shall we go here? Shall we go there? We've been lucky to go to places like Alaska, America, Canada, Ireland, Guinness Factory, where I met Liam, Eamon. So yes, my goal is to see as much of the world as I can before IPF restricts me from travelling.
And it was something really interesting that you said there, and I think it's you said since we were diagnosed, and I think that's a very important point. And I know it's something, Ron, when we spoke in the last couple of days, that was mentioned at the EU-IPFF meeting, and I know, Jen, it's something you're quite passionate about as well. So Jen, maybe over to you first, because you want to talk about the carers and the role of the carers, it being so important in pulmonary fibrosis.
It's a tremendous, important role, but also in that it's not, like I had said before, it affects the entire family system. It is completely shifted, and it's interesting how people, as we all take roles in our family in typical life, roles sometimes switch as we're diagnosed with an illness. And so being able to highlight that, in that the importance not only of taking care of patients living with pulmonary fibrosis, it's very important to highlight and support caregivers. There is, if there's an opportunity to be able to have a support group for caregivers, because sometimes when we're in a support group setting with patients and families, sometimes a caregiver doesn't feel always comfortable to be open and disclose really kind of what they're going through as themselves and the relationships and how all that shifts. So it's extremely important of doing your very best, of moving forward as a family unit, but it really exacerbates things for sure when we're dealing with very, very serious feelings as you move forward navigating pulmonary fibrosis. And Ron, you had mentioned before about pulmonary rehab, that of course as well. And not only pulmonary rehab, I'm just going to circle back if you don't mind with that. If you have, and if you're moving forward for a lung transplant, staying healthy as possible, if that's a direction you choose to go to, is another benefit of pulmonary rehab, just because recovery after lung transplant is so important, is how well you're conditioned. And so I think that is a huge attribute or a benefit for pulmonary rehab. But yes, caregivers are extremely important in the family system moving forward, young and old.
Ron, Ron, is there anything you'd like to add to that? Because I know something you mentioned was discussed at the meeting you were at over the weekend.
About caregivers or about...
Well, yeah, back to the caregivers theme, but if you want to add anything else on the pulmonary rehab side of things.
I always take my partner to every appointment that I have, and I say partner, my wife, she just looked at me quite I take her to every appointment. I keep her fully involved in what is going on, because when I heard 3 to 5 years on an average, I switched off. So it's always nice to take someone with you, family member, wife, partner, brother, sister, that they can hear and have an input into your treatment plan. With regard to pulmonary rehab and keeping fit, I would say the purpose that I believe oxygen is for is to protect my heart, my liver, and my kidneys, that I don't do any damage to them if I'm over exercising, so I can have that lung transplant if needed.
And that's something that you're planning for the future. So that's something that you've decided you want to go for.
Yes.
Jen, there's an interesting comment from someone. So I think it is amazing for people, that have the support of caregivers. But Juliana has commented, I could only wish to have that kind of support from a caregiver. It's tough to be your own caregiver. So what advice would you give to someone in that situation?
Hi, Juliana. I know Juliana. Well, moving forward and not having the opportunity to have the support from your caregiver as much as you need to, having and supporting yourself and surrounding yourself with a pulmonary fibrosis community. It doesn't identify you, but being surrounded with a pulmonary fibrosis community and your support group, you have people who support you. And I think that would be one of the things that I would say in terms of reaching out and needing that support, to be able to reach out some way with your support group, your pulmonary fibrosis community. And Julianne's a very huge advocate of herself and pulmonary fibrosis, and that's another part of it too. We had talked about that earlier, how important that is, to be your own advocate moving forward. So that's what I would suggest.
Okay, no, that's really good advice. We seem to have lost Matt, so technology is not our friend today. But I'll just start going to some other questions that we've had coming in. So there was one from before the broadcast from Alice. So I suppose the one thing I would say is I think people here can only give general advice. So this question relates to changing a treatment plan. So I think Alice, you definitely would need to consult with your health provider before altering oxygen flow or things like that. But Jen, have you any general advice? This is from Alice. I've had IPF for 3 years now, on oxygen the whole time. I've always shown on my oximeter 98% while on 3 liters. Now I'm registering only 92 to 94%. So maybe some general advice, but I don't think we can give anything specific. I think they need to talk to their specialist.
Right. I agree, Eamon. You would have to, Alice, head back to your pulmonologist, reach out to your pulmonologist or nurse practitioner, whomever that you're in constant contact, respiratory therapist, and inquire about this. Unfortunately, my background isn't medical. I don't have a medical background. It's primarily support and education. And so that's what I would recommend.
Sounds, yeah, I think that's the right advice.
Mm-hmm.
Some other questions that we had in from patients related to, how do you get the most out of medical appointments? So, Ron, did you want to talk in relation to that, about how someone could get the most out of preparing and, for a medical appointment?
Well, what me and my wife normally do, is what I can talk about, is we make as many questions on paper, write them down before we go. Obviously, we'll always 4 or 5 questions about pirfenidone, questions we want to ask. My wife is very vocal in asking a lot of questions with the healthcare professional. Obviously, when we go to hospital, we have a lung function test. We have 6-minute walk tests, so we actually panic on what the doctor is going to say, because it's quite a pressurised system, because sometimes you don't know if you declined 3 or 4% or whether you're the same. So all I'd say to people is take someone with you and write your questions down before you go, because nothing's worse coming away from a healthcare professional not asking the correct questions. There are websites out there can I mention other companies? You know, on the Boehringer and Roche sites, there are packs that you can download that actually says what type of questions you should ask your healthcare professional.
Also, Eamon and Ron, and everybody, we have, what you can do too is when you go to not only writing down your list of questions, Pulmonary Fibrosis Foundation has a form of appointments, and you can write notes down. And when you write those notes down, when you go back to your appointment, everything is documented. And so what we try to do with our groups and with folks that we work with, we have a binder for them. Maybe think about creating a binder, and you have your educational information. So we have tabs. So you have what is pulmonary fibrosis, your CT scans, PFTs, your insurances, your medical information, legal information possibly. And so when you go to your appointments, you get double copies of everything and you put them in the tab. So when you go back to your appointment, you say, okay. And so you, again, advocacy for yourself. And when you go back to your appointment, you have everything organized and documented. And then all throughout our binder too, we also have a portion where we have, you can put business cards, because I know a lot of folks can relate. You're given a lot of business cards to keep those organized. And we have another part in it with this binder where we have a section where you could pick pictures of your family and your friends. And so that's why you're working so hard and doing the best you can. And you look at it and you're like, yes, all right, today's another day. And then at the end part, we also have, make sure you keep all your support. And DI also has, Ron, which I'm sure you've seen this, and your wife, a caregiver brochure. And they also have a pamphlet, and I think this is what you're talking about, Ron, is how do you talk about your family, or talk about with your family about what you're going through, and have kind of bringing up the topic if it's appropriate for your family system. And so maybe if you have an opportunity, you could create some type of binder. We, of course, have some here. If anybody's interested, they're free and we can send them to you, no problem. And it just makes things, because you're trying to manage every single day. One, to breathe, the logistics of getting to your appointments. And here you have a binder, and a lot of us, I know we're very human, of course we are, but we sometimes, I know I do, I need something tangible. I need something to hold on to. This gives you that control of your treatment and navigating your disease. So, and apps are always excellent. Pulmonary Fibrosis has an app as well that helps the communication and understanding of the information and putting everything organized. So I would highlight being organized and having the questions listed as Ron had mentioned, and a binder of some sort or an app that would be appropriate for you.
Ron, there's an interesting question or comment/question that's come in from Debbie. A member was recently told by his pulmonologist that he was too old for transplant. How can we educate our providers of the true facts? So I know different transplant providers will have different rules, but can you tell me a little bit about the process of being considered for a lung transplant where you are at Papworth Hospital?
Okay. Hi, Diane. First and foremost, we've had a couple of people in my support group that have had lung transplants at the age of 69. So they were extremely fit. I currently have met the lung transplant team. Not because I need a lung transplant, it's they want to plant the seed that I may need a lung transplant in the next couple of years. So I see them on a 6 monthly basis where they introduce me. So that if any time I have an exacerbation or I have a steep decline, they will call me in for a 4-day assessment. What that 4-day assessment does, as far as I'm aware, we'll look at your family network, we'll look at support you have behind you. Obviously, they'll take bloods, they'll look at your heart, because any problems to your hearts or any other organs may not be suitable for a lung transplant. So at Papworth, we're very lucky. My standard life at the moment is too good for a lung transplant. But I'm fully aware that, if I got the flu or I had an exacerbation, that could be just around the corner. So at Papworth, they do monitor us very closely.
And Debbie, I would suggest, because every lung transplant center is very different in their criteria, and there could be other comorbidities that are involved in the evaluation for a lung transplant, maybe particularly to the patient. Yep. And, but he or she could get a second opinion, see what else is out there, and see if there's an opportunity for an evaluation through another lung transplant facility. And yes, I see just one was transplanted at 72. And so it varies very widely, essentially, for patients. And it really, as we hear all the time, it depends on each individual patient and what's appropriate for them. But see if that's a situation, maybe see if there's a second opinion that they can reach out to a lung transplant facility.
Yeah.
Can I just butt in there? Well, I think when people are first diagnosed with IPF, it would be a great time to assess them for a lung transplant at that particular time. Because if someone's got a hiatus hernia, if that's not picked up at the first stages, it may preclude them for a lung transplant 2 or 3 years down the road. So I think everyone should be tested on diagnosis, or at least introduced to a lung transplant team.
And they also, Ron, that's a great point, because the transplant team gets to know you as a person, right? And so they get to know you, your family, like you said, other type of issues that are possibly at the moment, if not going on further. So it really sets the tone in the type of direction that you want to go to. But you're developing that relationship with your transplant team right from the beginning. And so it's, earlier the better. We talk about a lot.
Yeah.
So the key message, and we've come across it from quite a few people, the earlier you investigate your options, the better. And if needs be, get a second opinion. If certain transplant says, oh, you're too old. So that may not be too old for another transplant center.
Right.
Question from Jim. What is your main symptom that sent you to the doctors before, after, and today? So Jim, I'm wondering, do you mean, maybe if we kind of refer to it in terms of people who are, managing their treatment. So what is it you look for, Ron, that would make you think, okay, I need to go to the doctors?
Right. I've just got my route to diagnosis out, so I might read a few notes from my route to diagnosis. 2011, I visited a GP with a persistent cough, and I was sent for x-rays. They came back clear with no further referral. May 12, I went back with the same problems, still coughing. He told me it might be probably previous smoking habits. So he turned me away again. I went back in 2013, again with the same symptoms. I was given a brain inhaler. I was given medication for stress. X-rays come back clear, but this time he referred me to a consultant. So I would say the 3 symptoms that I had was a severe cough in the morning, bringing up a lot of phlegm, and constant out of breathness just by walking up a flight of stairs. And they're the 3 main symptoms that I showed. but it took 2 years to get from my first going to the doctors to actually getting to a CT scan.
And now that, because I'm not fully sure that the exact context of Jim's question, now that you have your diagnosis, what is it that would that you would see that would make you go to the doctor's office, if you today or tomorrow? So what kind of things would concern you that would make you go to the doctors?
Any cough over 3 weeks, 3 or 4 weeks. And I think the most important thing is the out of breathness walking up a flight of stairs. If anyone has got breathlessness, don't put it down to age. Don't put it down, I'm getting old, I've just walked up a flight of stairs, I feel breathless. If you feel breathless after walking up a flight of stairs or a hill, go to the doctors or your GP.
Yeah.
I would also an oximeter too, to maintain where your oxygen is. So you have your oximeter and you're able to always, that's always a balance. You don't want to overdo it and be consumed by it. But, if it's a constant level of 88, 89, that's something to revisit your physician about for sure. So I would recommend getting an oximeter.
Alice's question from earlier. So where you're in a steady state and then there's a decline to a lower steady state, that is something that should warrant a visit to the doctor's office.
Right, and if you're at the point where for the exacerbation, when you can't recover from being breathlessness, that's when you need to call 911. That's a more of a critical situation.
Yeah.
On these themes, Ron, so what do you do to monitor yourself at home? So what kind of things do you do? I know you do spirometry at home, if you want to kind of mention that to people.
Well, I do my spirometry test at home, and the spirometry test is possibly the best app I've ever used, because it's allowed me to not only to manage my FVC, but also show me that I'm remaining relatively stable. It also shows me if I'm a bit down or I'm coming across a cold, my FVC levels go down, so it can predict, or it's looking at it, because I've been on it for 1.5 years now, so it's actually showing me, and I'm allowing to monitor my own symptoms and my own levels. Can you repeat the question, because I've just lost my train of thought?
So it was what things you do at home to help you self-manage. Thanks for the kind words about patient empower. But is there other things that you do that help you self-manage at home?
I just, like Jen said, I record my oximeter on a regular basis. I go as many little walks around the block as I can. My coughing, my wife will make sure when I'm in the shower that she's nearby, because I have severe coughs in the morning, so she doesn't want me blacking out in the shower. And she's constantly looking after and monitoring, make sure that I'm fine. So it's just a case of being together with my partner or wife, making sure that I'm fine.
I mean, simple things too, Ron, which I hear a very consistent theme is living your life every day the best way, and trying to do the most fulfilled way that you possibly can. And I think that's really important to think about on a daily basis, of living in the moment of every day. Hi, Matt. Living in the moment of every day and appreciating every day. So it's a very consistent theme in the conversation, and to highlight that, I think that's very important. And in the shower too, you could take oxygen in the shower.
I didn't realise that, actually.
Yes. That's one of the many things that's the benefit as in a support group, is that double check with your pulmonologist. But I know constantly I hear from patients, what do I do in the shower? And patient after patient, take your oxygen in the shower. and if you need a stool, to sit in the stool safely. But that, like I said, that is another benefit of the social strong network you have, because as you guys know, that you become very close, and it's a family, setting. And so that type of information that you can gather from each other is very valuable. So so that might be helpful.
Yeah, thank you.
Matt, welcome back. The technology gremlins got to us. Unfortunately, we can't hear you still, though, and you're not muted. So no, we still can't hear you. I'll follow up with John for you, which is a question around your pulmonary rehab, which he has. Question from Ruth. So for Jen or for Matt, has anyone been diagnosed with a rare disease along with IPF called Dercum's disease?
I've never heard of Dercum's disease.
I haven't either.
But you often hear about autoimmune diseases, sarcoidosis, scleroderma, other type of comorbidities. But honestly, that's something that I need to look into. I've never heard of Dercum's disease. Thank you for sharing, Ruth.
Yes, thank you.
One thing that's coming up a lot.
You got it, Ruth.
A lot of people like the sound of the binder. So I think anything that people can do to get better organized at home is a really positive thing. There was another question from someone that was stable. So if you're holding your own using Esbriet, should you still consider a lung transplant? And I think the message that came from you both is it's never too early to start the discussions and to consider your options.
I agree.
Yeah, totally agree.
And what a beautiful thing that we have two medications to help maintain the progression of course, we all know it's not a cure, but maintain the progression of the disease. So what a blessing that we have Esbriet and OFEV in order to maintain as possible until it comes to a point where the option of a lung transplant is in the forefront.
Yeah. Matt, it looks like your sound is back.
Oh, great. Lovely. Yeah.
So there's
Glad
a question.
to hear that.
So maybe on the theme we were just talking about. So I know you perform spirometry at home as well. So do you want to just talk about the benefit of that for you and for?
I do. Yeah, certainly. I'd love to. Personally speaking, I find this is one thing I found very reassuring, because only as recent in the last few months, I'm able through your own app actually, like I'm able to get a printout of results, and I'm able to record every day the FVC levels. I'm able to jot down in the journal that's on the app the situation that prevails. So just to say to everyone concerned, the one thing that I find great is that the way you might feel and the results that are shown are two different things, perhaps. And so where the results on the app are very objective, subjectively, you might be feeling rather poorly. But so when I go, as happened, the last two visits to my respiratory consultant, he was really interested in that. He likes the idea of that. And for me, I just feel an awful lot more at ease as a result of it. But it's not just that, but it's tracking it over a period of time. Because if there's 6 months of a gap between one consultant visit and another, it's hard to recall that information. So I just have found it terrific. And it's not just that, but I also feel that when I'm at home here, rather than write things down, before I would have written down things in a diary and all that, fair enough. But this is just all contained. So when you go, you've got very limited time with a consultant. So if you can just, and which he did, by the way, he just looked at it very quickly. The information can be gleaned very quickly like that, as opposed to writing down information. So all I can say to everyone concerned, I know I might be promoting your own app now as such, Eamon, but it really has been a great experience, over the last year.
I think it's whatever works for people. So
whatever works for people. It is certainly
the right thing for someone.
Yeah.
The key message is be prepared. As message from Jim. As patients, they are our best advocate. Better we're able to track activities and log data. It doesn't matter if you log it on paper or log it on app. If you're logging, you're more empowered and you're better informed. I think that's the key message.
Correct.
Another question for you, Matt, that came in while you were away from John. So you mentioned you take part in regular pulmonary rehab.
Yes.
So his message is, are the sessions run by specialist physiotherapists or others, and is it specialised to specific conditions?
No, they're not. They're run by fitness instructors that are actually in Dublin City University, but they're not specifically, their background wouldn't necessarily be in IPF or anything of that nature. But they are, like, in fairness, goes back to what Ron said earlier. The most important thing is they do watch it, and they ask you, are you okay? And very importantly, they say to actually exercise at your own pace, wherever that might be. So, but it is, and I bring the oximeter with me, to measure that. But you're all checked for your blood pressure before, and you can check it after the session if you so desire, But you do keep an eye on it, but they're not from that background necessarily.
Sorry, I was on mute. Jen, any closing comments from yourself just before we wrap up? Any further advice maybe that we haven't covered that you'd like to tell people?
Just to reiterate that there's support and education out there, and folks do not need to move forward this alone. In looking into the areas of support groups, pulmonaryfibrosis.org has per state, country of where one is. I know they're not as pervasive as we hope. Hopefully one day we will definitely get to the point where in more of your close region you would have a support group. And I also would like to also reiterate the importance of education. And when we are dealt with something that we don't know a whole lot about, we become fearful, scared, and we have anxiety, we're anxious about it. So the more education, the less fear of it and the more knowledge about it. And that allows you to propel forward in navigating pulmonary fibrosis. Yeah, I just think that outreach is extremely important, and being active and approaching it in the wraparound approach I had mentioned earlier with understanding the pathology of the disease, pulmonary rehab, oxygen management, palliative care, and support and education. And to have that type of mindset moving forward will help propel you forward in dealing with this.
Sounds excellent. A lot of comments coming in looking for information about the binder, so we'll put that into the comments section.
Absolutely. And if anybody wants to learn, Wescoe Foundation for Pulmonary Fibrosis, you can see our heartfelt cause, as we all feel it is our heartfelt cause moving forward every single day. We are pushed every single day to help ourselves, our families, and others with pulmonary fibrosis. But you can look on our website. It's Wescoe, WESCOE Foundation for Pulmonary Fibrosis.org. And, you learn about the story, but also of what we do and information of how I can send you your binders too. So I'd be happy to do that. And I'm glad that it definitely will be a benefit to folks.
And there's more questions and comments coming in. It's probably a topic in its own right, which we might get to. Criteria to be accepted for a transplant. Ron, I suppose, given that you're going through that process now. Do you want to maybe just give a quick overview in terms of, for your hospital, what criteria they've looked at?
Well, from my hospital, I would say remain fit, remain positive, join a support group, meet like-minded people. Support at first diagnosis is so important. Join a pulmonary rehabilitation. Visit websites such as Fight IPF, British Lung Foundation, Action for Pulmonary Fibrosis, the Pulmonary Fibrosis Trust. Learn as much about the disease as you can. My motto is, I'm heading towards a lung transplant, but I'm doing everything in my power not to have that lung transplant, to keep fit, to keep healthy, to keep diet. I'm doing everything within my power to avoid it. But if needed be, I will go ahead and have that transplant.
And, to go along with those websites you mentioned, Jen mentioned some others earlier, the American Lung Association, the Pulmonary Fibrosis Foundation, CHEST. So, those are ones for the US that are appropriate. Matt, any closing comments from yourself in terms of any last?
Well, I almost add to what was being said. Like, it's so important to be aware of for example, in Ireland, the Irish Lung Fibrosis Association have a wealth of information out there, and whether it be people want to be at home exercising, there's actually a DVD to help them doing that, because it relates to what Ron said. Exercising is so important, so you don't have to physically go out. You can, if you're aware of what's available, you can do it at home. It's all doable. But what's important really is to know where that information is coming from. Now, I'm only familiar with the one, the Irish Lung Fibrosis Association information, but they have a wealth of information like that, that would be beneficial. The 2000 Steps program, which all to do with encouraging people to get out there and walk and, improve their mobility and improve their health for, in the best possible way. So I would say, going back to what Jen and what Jen said earlier, it is so important to get that information across, and that it's all, at least all the information is very trustworthy. It's very honourable. It's true to the point of there's nothing ambiguous about it. It's written in layperson's terms, and that's what really patients need.
Mm-hmm.
Excellent. Well, listen, thank you very much for all your time today. If there's any questions we didn't get to, we'll get to them in the comments. And just also to mention, please look out for this time next month. We'll be doing a live broadcast from the American Thoracic Society conference, which will be themed about the updates in terms of the science and new published clinical trials in pulmonary fibrosis. So quite a few of the patient empower team will be there. So we'll be bringing you updates from that this time next month. So thank you very much to Ron, to Matt, and to Jen for your time
Thank
today.
you.
Thank you.
Everyone for
Thank you for having us.
Thank you very
Thanks
much.
for having us.
We'll
Appreciate
talk to
it.
you next month.
Okay,
Bye-bye.
take care, everybody.
Bye-bye. Take care. All the best. Bye.
Bye.